What? This is awkward, isn't it? But we need to talk about it. That strange, persistent smell. Yes, urine. No, you're not imagining it. And you're definitely not the only one noticing it either. As an older woman myself, I started picking up on a scent I swore wasn't there in my 40s or even 50s. And when it lingered, even after showers and clean clothes, I started digging. And let me tell you what I found. It's a bit gross, a bit shocking, but completely fixable once you understand what's really going on. So, here are 12 crazy reasons women like us might start smelling more like urine as we age, and what the doctors have to say about it. Trust me, number 7 nearly knocked me off my chair. Reason 1. Hormonal changes after menopause. Let me tell you, menopause doesn't just stop your periods, it rewires your whole body. And one of the biggest culprits in the urine smell mystery is estrogen, or lack of it. See, when estrogen drops, your body loses moisture in all the wrong places. I'm talking thinner vaginal walls, drier tissue, and a less acidic pH. All of this creates a playground for bacteria. Now normally, your vaginal and urinary systems are self-cleaning and pretty good at staying fresh. But when estrogen vanishes, that fresh balance gets thrown off. Even a little bit of leftover urine, or sweat, can smell stronger than it used to. It's not that you're dirtier, it's that your body's defenses are weaker. Some doctors even compare the internal changes to a shift from a moist, garden-like environment to a dry desert. Charming, right? Reason 2. Thinning skin, especially around the urethra. This one surprised me. As we age, our skin loses collagen and elasticity, but that includes the sensitive skin down there, too. The urethral opening, where the urine comes out, can become smaller, drier, and more fragile. The result? Urine doesn't always flow out cleanly or quickly anymore. Some of it might dribble, cling to the skin, or even get trapped in little folds. And guess what happens then? That tiny amount of leftover moisture becomes a breeding ground for bacteria, and bacteria love to party. Especially the kind that break down urine and release those nasty smells. So even if you wipe perfectly, even if you shower every day, that scent can stick around because of what's happening beneath the surface. Reason 3. Mild incontinence, even if you don't realize it. Let me just say this loud and proud. You don't have to be wetting yourself to be leaking. There's a little thing called stress incontinence, and it happens when you laugh, sneeze, cough, or lift something heavy. Maybe it's just a few drops. Maybe you don't even feel it, but it adds up. And here's the tricky part. Those small leaks dry into your underwear, or worse, get absorbed by panty liners or pads and hang out there for hours. Even after you think you've cleaned up, the odor lingers. I had no idea this was happening to me until I switched to black underwear and noticed faint marks every time I did laundry. Suddenly it clicked, that smell wasn't in my head. Doctors say up to 50% of women over 50 experience some level of leakage, but most don't talk about it. We feel embarrassed. We think it's just part of getting old. But knowing it's happening? That's the first step to doing something about it. Reason 4. Dehydration. Yes, it changes your smell. This one might be the most ironic. Many of us drink less water as we age because, let's be honest, who wants to run to the toilet every hour? I used to avoid water like the plague if I was going out, just so I didn't have to scout for public restrooms. But the less water you drink, the more concentrated your urine becomes. It turns darker, thicker, and smellier, like ammonia or metal. That concentrated urine is much stronger in odor, and once it touches your skin or clothes, it sticks around like an uninvited guest. Worse still, if your body's even a little dehydrated, it has a harder time flushing out waste, so your whole body, sweat, breath, everything, can start smelling a bit off. The fix is simple but annoying. Drink more water. I know it sounds basic, but even increasing by 1 glass in the morning can make a huge difference. I started adding lemon to mine, just to trick myself into drinking it. Works like a charm. Reason 5. Medications that affect urine odor. Now here's something most people don't think about. Many common medications, especially the ones we start taking as we get older, change the chemical makeup of our urine. I'm talking about blood pressure meds, diabetes meds, antidepressants, diuretics. Even some supplements like vitamin B6. These can make your urine smell stronger, more bitter, or even downright metallic. And again, when that smell lingers on the skin or gets absorbed into your clothing or pad, it doesn't just go away with soap and water. Some meds also dry out your mouth and body, adding to dehydration, which, as we just learned, only makes the problem worse. If you suspect your meds are making things smell funky, don't stop taking them, but talk to your doctor. Sometimes there are alternatives. And at the very least, you can work on the other factors to counterbalance it. Reason 6, poor diet choices. Yes, food affects the way you smell. Let's talk food, shall we? You've probably heard that eating asparagus can make your pee smell weird. Well, it's not just asparagus. Turns out, what we eat has a huge impact on how our body smells, especially our urine. Diets high in red meat, processed snacks, sugar and artificial sweeteners, alcohol, can all change the way your urine smells and how your body processes waste. For instance, sugar feeds bacteria, including the bad kind that causes urinary tract infections or imbalance. Too much caffeine dehydrates you and amplifies the smell of urine. Even spicy foods can sweat out through your pores and combine with trace urine on your skin to make you smell like, well, something's died. When I cut back on sugar and started adding more greens, fruits, and water-rich foods to my meals, within a week, I noticed a difference in how I smelled after using the bathroom. No perfume or powder needed, just less funk. Reason 7, not changing pads or liners often enough. Doctors say this is the most overlooked. Alright ladies, this one's a biggie, and doctors are practically screaming about it, yet so many of us ignore it. If you wear pads or panty liners to catch light leaks or discharge, great, you're being proactive. But are you changing them often enough? I used to pop one in the morning and forget about it until bedtime. Sound familiar? Well, turns out those pads act like little sponges, and if you don't swap them out every few hours, they start fermenting whatever they've collected. Yup, fermenting, like a gross little scent factory stuck to your body. Even worse? Some of them have plastic backings that trap heat and moisture, making the smell even more intense. So if you're using pads, especially for bladder leaks, change them frequently. And please, choose breathable, unscented ones when possible. Scented liners just mix perfume with pee. It's not pretty. Reason 8, UTIs that go undetected. Here's a little secret no one tells you. UTIs get sneakier as you age. Back in the day, you'd know right away, burning, urgency, the works. But in older women, urinary tract infections can show up with almost no symptoms, except one, a strong, foul-smelling urine odor. Sometimes it's the only clue. If you've ruled out everything else and that smell still lingers, don't wait. Ask your doctor to test your urine. A simple antibiotic could fix a problem you didn't even know you had. And if you're getting UTIs repeatedly, that's a whole other conversation, and one you shouldn't be having alone. Advocate for yourself. You deserve answers. Reason 9, slower shower habits. Let's be honest. Now, I'm going to tread lightly here, but be honest with yourself. Are you showering less often than you used to? As we age, daily showers can feel like a chore. Maybe you're tired, your balance is off, or it just doesn't seem necessary every single day. I get it. But the truth is, even if you're not sweating much, bacteria and trace amounts of urine can build up quickly, especially in warm areas like the groin or under the belly. So while you might skip the shampoo, don't skip a quick rinse down below. Even a warm washcloth and gentle soap in the right places can make all the difference. It's not about being dirty, it's about maintenance. And fresh feels good. Reason 10, wearing the wrong underwear. Let's talk about panties. Yes, those cute lacy ones might have worked when we were 30. But now, if you're wearing synthetic, tight-fitting underwear, you're basically creating a mini greenhouse down there, hot, damp, and poorly ventilated. Perfect conditions for odor to thrive. Cotton is queen. Loose, breathable, simple cotton panties help absorb moisture, let air circulate, and reduce that dreaded trapped urine smell. Bonus tip? Ditch the shapewear every once in a while. It looks great, but it locks everything in, including odors. Reason 11, limited mobility or health conditions. Now this one's tough, but it needs to be said. If you struggle with mobility, arthritis, or other health issues, it might be harder to get to the toilet quickly or clean up thoroughly afterward. Sometimes, that means sitting in urine a little longer, or not wiping as effectively, or skipping a change of clothes because it just takes too much energy. And you know what? That's not your fault, it's just life. But if that's you, consider products like cleansing wipes, barrier creams, or even handheld bidets. They can make a world of difference and save your dignity too. Reason 12. No sensitivity changes? Yes, really? Here's one you might not expect. Your nose changes with age. Some women become hypersensitive to smells, noticing every little scent and wondering, is that me? Others lose some of their sense of smell and don't even realize the odor is there at all. That's why some women are paranoid, and others are blissfully unaware. Neither is wrong, but it helps to ask someone you trust if they notice anything. And don't be embarrassed. A good friend will tell you gently. A great friend will tell you before the grandkids do.